what they mean by that prophylaxis is a preventative. Okay. Where things often get more challenging is when symptoms persist or develop later. And for people dealing with ongoing fatigue, joint pain, brain fog, or neurological issues months or years after treatment, many conventional doctors follow the current guidelines and diagnose it as post-treatment Lyme disease syndrome, or PTLDS. The view is often that the infection itself has been cleared, but the body is left with lingering inflammation or immune system changes. At that point, longer courses of antibiotics are usually not recommended because large studies haven't shown clear long-term benefit. And there are risks like gut disruption, antibiotic resistance, and side effects. Co-infections add another wrinkle. Babesia often needs different medications, things like ativaquone and azithromycin, while Bartonella might call for a different combination. But not every doctor routinely tests for or treats co-infections, so they can get missed. The standard two-tier blood test can miss infections, especially if done very early or if the immune system isn't mounting a strong antibody response. Because it can be so subtle in the system. And that leads to a lot of people being told that your test is negative, even when they're clearly struggling. But for the thousands of people who end up with chronic or persistent symptoms, the ones who feel dismissed, who are told it's all in your head or just anxiety, that's where a lot of the frustration comes. And when the origin story involves documented secrecy and slow acknowledgement of the full scope of the problem, it's easier to see why trust has been eroded for so many people. This is why so many people turn to holistic and integrative approaches. Not to reject medicine where it works, but to go deeper when the standard path leaves people still suffering.